Think you know the truth about respiratory infections? You might be surprised. In today's video, we're tackling some of the most common myths surrounding respiratory infections and illnesses. Let's bust some myths with some real science and expert advice. Myth number 1, colds are caused by cold weather. This is a misconception. Colds are caused by viruses, not the temperature. When we spend more time indoors during colder months, we're in closer contact with others, making it easier for viruses to spread. Stay vigilant, wash your hands regularly, and avoid close contact with sick individuals. Several studies have demonstrated a significant association between cold weather and an increased incidence of respiratory infections. For example, a study conducted in Seoul found that cold temperatures significantly increased emergency room department visits for respiratory diseases. Additionally, cold weather has been shown to impair the body's antiviral defenses. Exposure to low temperatures can reduce the effectiveness of interferon-induced antiviral responses, making individuals more susceptible to viral infections. In summary, cold weather can indeed increase the risk of respiratory infections through multiple mechanisms, including impaired immune responses and enhanced viral stability and transmission. Myth number 2, antibiotics treat viral infections. Antibiotics are effective against bacteria, not viruses. Misusing antibiotics can lead to antibiotic resistance, making bacterial infections harder to treat. You want to avoid antibiotics in general because you also want to protect your gut health. If you have a common viral infection, rest, hydrate, and let your body do its job. Some antiviral medications do exist, like those that treat influenza or COVID, but most don't need any medication. Here's a breakdown on the difference between bacterial respiratory infections versus viral respiratory infections. Bacterial respiratory infections are caused by bacteria such as Streptococcus pneumonia. Viral respiratory infections are caused by viruses such as influenza virus. Bacterial infections often present with more localized symptoms such as high fever, productive cough with purulent sputum, and pleuritic chest pain. They can lead to conditions like bacterial pneumonia. Viral infections typically present with systemic symptoms such as fever, myalgias or body aches, and non-productive cough. They often cause conditions like the common cold, bronchiolitis, or viral pneumonia. Bacterial infections are treated with antibiotics tailored based on the suspected or confirmed pathogen and its antibiotic susceptibility profile. Viral infections are generally managed with supportive care, including hydration and antipyretics. Antiviral medications may be used for specific viruses like influenza or COVID-19. In summary, while both types of infections can present overlapping symptoms, their etiologies, diagnostic approaches, and treatments differ significantly. Myth number 3, you can't exercise when you're sick. This is only partly true. If your symptoms are above the neck, like runny nose or sore throat, light exercise may be okay. However, if you have a fever or feel fatigued or have chest congestion, rest is essential. Always listen to your body. So yes, you can exercise when you're sick, but it depends on the type and severity of the infection. For viral respiratory infections, such as the common cold, moderate exercise may not worsen the severity or duration of the illness. Studies have shown that moderate exercise does not significantly alter the severity or duration of viral upper respiratory infections. However, it is generally advised to avoid strenuous exercise during acute phase of a viral illness due to risk of complications such as myocarditis. For bacterial respiratory infections, the situation is more complex. While moderate exercise has been shown to have some protective effects against pulmonary inflammation induced by bacterial infections like Streptococcus pneumoniae in animal studies, exercising during an active bacterial infection can potentially exacerbate symptoms and delay recovery. It is generally recommended to rest and avoid strenuous activities until the infection is adequately retreated with antibiotics and symptoms have resolved. In summary, mild exercise may be safe during mild viral respiratory infections, but strenuous exercise should always be avoided. For bacterial infections, rest and appropriate medical treatment are crucial before resuming any exercise regimen. Always consider the severity of symptoms and consult clinical guidelines or a healthcare provider for personalized advice. Myth number 4, masks are only necessary during pandemic. In reality, wearing a mask can help reduce the spread of respiratory infections like the flu and the colds, especially in crowded or enclosed spaces. When respiratory illnesses are circulating, wearing a mask can provide an extra layer of protection. During the COVID-19 pandemic, the widespread use of masks, along with non-pharmaceutical interventions, NPIs, such as social distancing and hand hygiene, significantly reduced the incidence of other respiratory infections like influenza and RSV. For example, a study published in Viruses demonstrated that high mask use was associated with low detection rate of influenza during the pandemic. Therefore, masks can be a valuable tool in controlling the spread of various respiratory infections, not just during pandemics, but also in other settings where respiratory pathogens are prevalent. Natural remedies can cure all respiratory infections. While some remedies can relieve symptoms, they're not substitutes for medical treatment. Always consult a healthcare provider for persistent or severe symptoms. Combining natural remedies with proper medical care is often the best approach. Some natural remedies, such as herbal treatments or nutritional supplements, have shown promise in managing certain respiratory infections. They're not universally effective for all types of respiratory illnesses. For example, various herbal protocols and nutritional interventions have been studied for their roles in upper respiratory infections, including COVID-19, with some positive findings. However, these treatments often require further clinical validation to establish their efficiency and efficacy and safety. Non-pharmaceutical interventions like mask wearing, hand hygiene, and social distancing have been proven effective in reducing the transmission of respiratory infections, including influenza and RSV. These measures can significantly lower the incidence and severity of respiratory illnesses by reducing viral transmission and improving indoor air quality. In summary, while natural remedies can complement conventional treatments and non-pharmaceutical interventions, they are not standalone cure for all respiratory illnesses. Comprehensive management often requires a combination of pharmaceutical treatments, non-pharmaceutical interventions, and supportive care. Myth number 6, you should avoid dairy products when sick. While some believe dairy increases mucus production, research doesn't support this claim. If dairy doesn't upset your stomach, it can provide valuable nutrients, so listen to your body and eat what feels right. The current evidence does not support the need to avoid dairy products during a flu infection. Dairy products, particularly those containing probiotics, may even have beneficial effects on the immune system. For instance, yogurt containing probiotics has been shown to enhance immune responses and reduce the severity of respiratory viral infections, including influenza. Moreover, there is no consistent evidence that dairy products negatively impact the immune response or exacerbate symptoms like fatigue or fever during an infection. While some studies suggest that high-fat dairy products might have adverse effects in certain contexts, such as COVID-19, these findings are not directly applicable to influenza and are not universally accepted. In summary, there is no need for patients to avoid dairy when they are sick with the flu, and some dairy products, especially those with probiotics, may even offer immune benefits. Myth number 7, will I get sick if I go outside when my hair is wet? No, patients will not necessarily get sick if they go outside with wet hair. The idea that going outside with wet hair will cause illness is a common myth. The primary cause of respiratory infections, such as the flu, is exposure to infectious agents like viruses and bacteria, not cold weather or wet hair. However, exposure to cold and wet conditions can stress the body and potentially weaken the immune system, making it more susceptible to infections. In summary, while going outside with wet hair in cold weather might cause discomfort or contribute to conditions like sinus headaches, it does not directly cause respiratory infections. The primary risk factors for respiratory infections are exposure to pathogens and individuals' immune status. Myth number 8, respiratory infections are only a concern for the elderly. Respiratory infections can affect individuals of all ages, including young, healthy adults and children, so it's important to discuss the importance of vaccination and preventative measures. Approximately 14.5% of older adults who contract respiratory infections are potentially hospitalized. Approximately 20 to 35% of older adults who contract pneumonia infections are potentially hospitalized. The incidence of pneumonia requiring hospitalization in older adults is significant. Myth number 9, healthy people don't need the respiratory vaccines like the flu shot. Even healthy individuals can contract and spread the flu, and vaccination helps protect the community. Approximately 12.9% of younger adults who get pneumonia infections are potentially hospitalized. This estimate is based on a study that analyzed the incidence of severe community-acquired pneumonia among younger patients under 6 years of age. The study found that 12.9% of younger hospitalized patients had severe pneumonia, indicating a significant hospitalization rate for this age group. Myth number 10, respiratory infections are always contagious. While many respiratory infections are contagious, some, like certain types of pneumonia, may not be easily transmitted between people. Bacterial pneumonia, especially caused by pathogens like Streptococcus pneumonia, is contagious and can spread through respiratory droplets. Are all respiratory infections airborne? Not all respiratory infections are airborne. Some are spread through contact or droplets. Here's the breakdown. Respiratory infections are contagious. They can be transmitted through several pathways, including direct droplet spread, direct physical contact like fomites, and suspended air molecules like droplets. In healthcare settings, the risk of nosocomial transmission is influenced by factors such as community incidence rates, viral load, symptoms, proximity and duration of exposure, and ventilation quality. In summary, respiratory infections are indeed contagious and can spread through multiple modes of transmission, necessitating appropriate infection control measures to mitigate their spread. There are 2 examples where respiratory infections are not contagious. Aspiration pneumonia, which occurs when food, liquid, or vomit is inhaled into the lungs, leading to infection. This type of pneumonia is not caused by infectious agents and therefore not transmittable from person to person. Another example is chemical pneumonitis, which results from the inhalation of toxic substances such as fumes or vapors, leading to inflammation in the lungs. This condition is also not contagious and is caused by the chemical exposure rather than infectious etiology or pathogens. In summary, while many respiratory infections such as those caused by bacteria and virus are contagious, there are specific types of aspiration pneumonia and chemical pneumonitis that are not transmittable. These myths can lead to misunderstandings and inappropriate management of respiratory infections. It is crucial to rely on evidence-based information for prevention and treatment. Thanks for joining me today as we busted through these common myths about respiratory infections. Knowledge is power, and staying informed can help you and your loved ones remain healthy. If you found this video helpful, please like, subscribe, and hit the notification button for more health tips. See you next time.